ಅಮ್ಮ ಹೇಗಿತ್ತು ಟ್ರೀಟ್ಮೆಂಟ್ ನಮ್ಮದು?
ತುಂಬ ಚೆನ್ನಾಗಿತ್ತು.
ಈಗ ಪೇಯ್ನ್ ಎಲ್ಲ ಕಮ್ಮಿ ಆಯ್ತಾ?
ಕಮ್ಮಿ ಆಗ್ತಾ ಇದೆ.
ಕಮ್ಮಿ ಆಗ್ತಿದೆಯಾ? ಇವತ್ತು ಡಿಸ್ಚಾರ್ಜ್ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊಳ್ಳಿ ಮನೇಲಿ, ಆಯ್ತಾ?
ಆಯ್ತಾಯ್ತು.
ಚೆನ್ನಾಗಿ ವಾಕ್ ಮಾಡಬೇಕು.
ಓಕೆ.
I'm Dr. Rajaneesh. I am Orthopedic Surgeon and Joint Replacement Specialist. I've been visiting Medstar Hospital for the past 3 years. So I mainly operate on knee and hip surgeries and concentrating on joint replacement and arthroscopic ligament injuries. So recently we came across a patient named RamaDevi. She's a 75-year-old female lady. She had a very bad osteoarthritis of the knee.
ಹೆಸರು ರಮಾಬಾಯಿ ಅಂತ. ಏಜು 75 ವರ್ಷ. ನಾನಿಲ್ಲಿ ಅಡ್ಮಿಟ್ ಆಗಿ 5 ದಿವಸ ಆಯಿತು. ಅಂದರೆ ನನಗೆ ಬಲಗಾಲಿಂದು ಮಂಡಿ ಚಿಪ್ಪು ಸೌಕಳಿ ಬಂದಿತ್ತು, ನಡಿಲಿಕ್ಕೆ ಕಷ್ಟ ಇತ್ತು, ಹಾಗಾಗಿ ಆಪ್ರೇಷನ್ನಿಗೆ ಬಂದಿದ್ದೆ ನಾನು.
Wherein the joint surface was completely worn out and there was a grade 4 arthritic changes. So she was suffering from a lot of pain and it was difficult for her to carry out her activities. Even walking and sitting, standing was a very difficult task for her. We made a plan for doing total knee replacement and I carried out the surgery and she is doing very well and she is able to walk around. We made her to walk in the very next day and she's completely fine and her pain has come down and she's able to walk with the walker support. And total knee replacement is a very satisfying surgery for complete osteoarthritis of the knee joint. And we use the latest implants and good surgical technique is very important for the recovery of the patient. And the advantage of total knee replacement is we start mobilizing the patient the very next day. We make them walk and by a week or two we are able to make them walk without a walker support and they are able to carry out all their activities without any much issue.
ಡಾಕ್ಟ್ರ್ ಎಲ್ಲ ಹೇಳ್ಕೊಡ್ತಾರೆ ಈ ಥರ ಮಾಡಬೇಕು ಅಂತೇಳಿ, ಅವ್ರದ್ದೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ನಮಗೆ.
So we mainly we operate on patients with complete degenerative osteoarthritis with very difficult mobility and functional impairment of the patient. So but knee replacement gives a very good result and patient satisfaction in long run.
5 ದಿವಸದಲ್ಲಿ ಡಿಸ್ಚಾರ್ಜ್ ಆಗ್ತಾ ಇದ್ದೇವೆ.
ಇನ್ನು ಇವ್ರದ್ದು ಇನ್ನೂ ಏನಾದರೂ ಡೆವಲಪ್ ಮಾಡ್ಕೋಬೇಕು ಅವರೆಲ್ಲ?
ಇಲ್ಲ, ಒಳ್ಳೆ ಸರ್ವಿಸ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಏನಿಲ್ಲ, ತೊಂದರೆ ಇಲ್ಲ. ಆಮೇಲೆ ಕ್ಲೀನಿಂಗು ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾರೆ. ಟೈಮಿಗೆ ಬಂದು ಅವರೇ ಕ್ಲೀನ್ ಮಾಡ್ಕೊಂಡು ಹೋಗ್ತಾರೆ.